I'm Dr. Alpa Atul Poorabia, Senior LASIK and Cataract Surgeon. I have my own clinic, CSR Eye Hospital in Jubilee Hills. I also work as a visiting consultant at Apollo Spectra, Kondapur. LASIK means laser in situ keratomeliosis. It is one of the type of laser vision correction surgery. It is basically a misnomer because there are many laser vision correction surgeries are available, but generally people ask that I want to get the LASIK done. So in laser vision correction there are basically different techniques available. One of them is LASIK surgery. So laser vision correction, if we talk, there are basically three techniques. One is surface ablation, second is LASIK, and third is lenticle based surgery. Refractive surgeries are the option available to those people who doesn't want to wear glasses or contact lenses. There are two types of the refractive surgery. One is cornea based solution and second is lens based solution. The cornea based solutions are laser vision correction, where with the help of the laser we reshape the cornea, and lens based solution means we permanently place one lens inside the eye. With the help of this surgery, the patient can become independent of glasses or contact lenses. Refractive surgeries are the solution available to those people who doesn't want to wear glasses or contact lenses. There are two types of the refractive surgery. One is cornea based solution and another is a lens based solution. In cornea based solution, we reshape the cornea by applying laser over the cornea. And in lens based solution, we permanently fix one lens inside the eye. With the help of this option, the patient can become independent of glasses or contact lenses. How laser vision correction surgery works. Let us first understand how normal eye functions. In normal eye, the outermost layer is called cornea, which is transparent, crystal clear, and it has a power. Behind there is a lens which also has a power, and there is a length of the eyeball, and generally there is a balance between these structures, and because of that when the rays are getting focused over the retina, we are able to see very clearly. If there is an imbalance between one of this structure, then patient will be having a difficulty in the vision, and to actually help these patients, we actually prescribe them the glasses in front of the eyes so that the rays will be focused over the retina and patient can see normally. If we want to make patients glass free, we cannot change the length of the eyeball. We cannot even disturb the lens because that is a God gifted natural clear lens. But we can change the shape of the cornea by applying laser. So that is what we do in laser vision correction surgery. By applying laser, we remove ultra thin layer from the cornea and we change the power of the cornea. We reshape the cornea. Because of that, now the patient will be able to see without the help of glasses or contact lens, because now the cornea power has changed and the rays will be focused over the retina. In laser vision correction surgeries, we actually remove ultra thin layer from the different part of the cornea and we reshape the cornea depending on the refractive error patient has. Suppose patient has a myopia, then we remove the layer from the center. We actually flatten the cornea. We reduce the power of the cornea. Suppose patient has a plus power, hyperopia, then we remove the layer from the periphery and we actually steepen the cornea. We actually increase the power of the cornea. That is how the laser refractive surgery works. But this is the basic principle of the surgery. To achieve this result, there are different types of the surgery or different techniques of the laser vision correction. One is surface ablation, second is LASIK, and third is lenticle based surgery. If you are interested in refractive surgery, your age should be more than 18 years and your refractive error or glasses number should be stable since last 2 years. You need to undergo suitability test, which we call it cornea scan or topography or oculizer or pentacam or upscan or Galileo. These are different names given to this test. In suitability test, We check cornea thickness, cornea power, and we look for certain irregularity indices. Basically, to check whether this surgery is safe in your eyes or not. So when we do suitability test, there are a couple of questions we answer to the patient. The first question is whether you are suitable for surgery or not. The second question, if you are suitable, which particular technique you are suitable for. There are patients who are suitable for all techniques, but there are patients who will be having a limited options depending on certain parameters which we observe on the topography. And the last question we answer, whether we can make your power 0 or not, and if not, how much power is going to be left. If you are a contact lens wearer, then stop contact lens at least for 1 week before going for the suitability test. After suitability test, your surgeon will discuss with you which technique is best for you. Each technique has their own values, their advantages and disadvantages. After evaluating the suitability test, your surgeon will discuss with you which are the options available to you or which technique is safe in your eyes. Every technique has their own value. They have disadvantages and advantages also, side effects and complications also. After evaluating all technique, you can decide depending on your comfort and budget which technique you would like to go for. Whenever we evaluate the patient, we generally give options depending on the parameters we observe. There are patients where all technique will be possible and there are patients who will be having a limited option. If they have a limited option, means you have to understand that particular technique is safe in your eyes and other techniques are not safe. If a surgeon informs any patient that you are not suitable for laser vision correction surgery, that means that this surgery is not safe in that particular patient's eye. That doesn't mean that patient eye has some abnormality. Patient eye is normal but not fit to go for the laser vision correction surgery. Those patients who have a thin cornea, high refractive error or higher number of the glasses, or irregularities indices which are abnormal on the topography will not be suitable for the laser vision correction surgery. In this patient, we look for another option called phakic lens implantation surgery. In phakic lens implantation surgery, we implant artificial lens which is a power like your glass or contact lens, which is positioned inside the eye in front of your natural lens without disturbing any natural structure. And with the help of this lens, patient can become a glass free or contact lens free and can see without any aid. Surface ablation is one type of laser vision correction surgery. In this surgery, we remove first layer of the cornea called epithelium and then we apply excimer laser which removes ultra thin layer depending on the power you have from the cornea and it will reshape the cornea. And then we apply bandage contact lens over the cornea. Once the epithelium is healed, we remove the contact lens and then patient's quality of vision starts becoming better. The way which we remove the epithelium, there are different names given to the surgery. One is conventional PRK surgery where the epithelium is removed mechanically. The second name is given LASIK where the first layer is removed by applying alcohol over the cornea. Third is LASIK where the first layer is removed by a small machine. And the last is trans PRK where the first layer is also removed by excimer laser. This is one of the latest and buzzing technology available today. Because the first layer is removed by excimer laser, it is also known as touchless or contact lens technique. And here the first layer is removed by excimer laser. It has become a very sophisticated and more precise surface ablation technique. In LASIK surgery, we split cornea into two, not complete split. There will be a hinge at one place and then upper part we call it flap, we lift it. This cut is either made by blade which is known as microkeratome LASIK or blade LASIK or this cut can also be done by femtosecond laser. That is why it is known as blade free LASIK or femto LASIK. So once this cut is created, the upper part, which we call it flap, it is lifted like a page of paper, and on the remaining corneal stroma, examer laser is applied. This examer laser will remove ultra thin layer from some of the areas and will reshape the cornea. Because we have reshaped the cornea, the power of the cornea will change, and it will be changed in such a way that patient will be able to see without glass. Now after correcting the cornea with the laser, we will position the flap back. There is no pad, patch, bandage or sutures over that flap, and that is why we will advise the patient to take a rest for 1 day, and next day onwards patient will be allowed to do normal routine activity and patient will be able to see also. Lenticule based surgery is also one of the laser vision correction option available today, where the femtosecond laser is used. Here the refractive corneal lenticule, depending on the power you have, is created in the corneal stroma along with the excess incision. Once the laser pass is completed, through that small incision, the anterior and posterior plane of the lenticule is separated, and then this ultra thin layer called lenticule is removed through the small incision. Because of this reshaping of the cornea happens, and patient is able to see without contact lens or glasses after the surgery. Lenticule based surgery is small incision, flapless, one stop and one laser surgery. Different company has given different names, and that is why different techniques are available in lenticule based surgery. Smile Pro, Smile, Clear, Silk and Atos. Yes, laser vision correction surgeries are permanent option, provided you had a good enough thickness to go for laser. Most of the patient, nothing happens till you become 40 and start getting the reading glasses. At certain age, you are going to develop cataract also, but till then you are glass free. Some of the patients can develop small power in the future. That is the genetic tendency they have. Otherwise, most of the patients remain glass free till they become 40 and get the reading glasses, which is known as presbyopia. If LASIK evaluation done properly, then there is no question of getting blindness from the laser surgery. In LASIK surgery, in laser vision correction surgery, the evaluation before surgery is very, very important. Means your suitability test, evaluation of suitability test, reading of the suitability test parameters are very, very important. If it is done properly, then this surgery is very, very safe in your eyes. If there is a compromise, then there are chances you may develop some sight threatening complications, either immediate future or in the long term also. All laser vision correction surgery, whether you take it surface ablation, LASIK or lenticule based surgery, they have side effect. Most of the surgeries will cause dry eye, which takes couple of weeks or couple of months to settle down. For that you need to use lubricating drop regularly, at least initially. Some of the patient may experience glare or colored halos around the light, which generally settle down with the time. With the advancement in the laser vision correction surgeries, today the laser surgery has become very safe, and quality of vision wise also patients are very comfortable. Phakic lens surgery, which is also known as permanent contact lens implantation surgery, is an option given to those people where laser vision correction is not safe. Phakic contact lens, which is an artificial lens which has a power like your glass, is positioned inside the eye, and with the help of this lens, patient become glass free. As it is a customized lens, you need to undergo a couple of tests before surgery, and then the lens is ordered. Once the lens is procured, you will be taken in operation theatre, and small incision is created over the cornea. From that, the lens is injected inside the eye. After injecting the lens inside the eye, it is positioned behind the iris and in front of your natural lens without disturbing the natural structure inside the eye. may have to take a 1-day rest, and next day onwards you are allowed to do your normal activity. Most of the patients' quality of vision wise very comfortable next day onwards. You may experience slight glare initially, but majority of the patients settle down in couple of days with the glare. This is one of the very safe surgery available to those people who are interested in to become glass free and not suitable for laser vision correction.